On today's Two on Your Side Town Hall, we're talking long-haul symptoms, vaccines, and more with a local doctor on a busy day for news in the fight against COVID.
Plus, the Verified team takes on claims about Governor Cuomo and Mayor Byron Brown and gets some answers.
And annoyed when that free trial turns into a subscription that you didn't really want? Well, there is now a new push to help with that. And even if that doesn't work, we're going to have an expert here to help you avoid getting tangled up in all of it.
Well, that metaphorical light at the end of the COVID tunnel has gotten pretty bright these days, with cases down, vaccinations up, and restrictions lifted. But we're not through it yet.
Yeah, and we keep learning more specifically about the long-term effects of people who have gotten the disease. And that's what we want to start by focusing on tonight. So there is this new report on patients with so-called long-haul COVID, people who suffered lingering effects at least a month after getting the virus. Now, this study was huge, looking at close to 2 million COVID patients total.
And it found that nearly 1 in 5 who never had any symptoms when they had the virus developed that long haul condition a month later, dealing with pain and breathing difficulties. Again, that was among people who never had any initial symptoms. And that is one of the things that we want to talk about right now with Dr. John Sellick, hospital epidemiologist for Kaleida Health. Dr. Sellick, it's great to have you back. Thanks for your time tonight.
Okay. Thank you for having me again. I'm glad we don't talk about COVID as much anymore.
Yeah, Kate and I were discussing that during Most Buffalo, how we aren't entirely focused on that every day now like we were. Let's start with this study because it is pretty jarring. When you hear that you are asymptomatic, it sounds like maybe you're in the clear, but this is making clear to us that there is a pretty good chance, 1 in 5, that you could have a rough time later on with this long haul symptom.
Yeah, this one particular study, is it's kind of a high level done using a billing database, but there have actually been a fair number of clinical studies with a large amount of information going into them, showing that anywhere between a few percent and some of them even as high as 75%, but mostly around 30% of people will have some extended symptoms after they have COVID. But as you point out, sometimes you don't know that you have it. And we've seen people like this where they come in with the things that CDC is calling the post-COVID conditions, where they come in with some of the, fatigue, muscle aches, headache, brain fog, loss of sense of smell or taste. And they didn't even clearly have a clinical episode of COVID. So we know that there's going to be a fairly large number of people who wind up with these post-COVID symptoms that we really don't know exactly what they all are, what causes them, and what we should actually do to treat them.
Dr. Sellick, we also want to talk about the variants. We got the headline from UB last night that the Delta variant was found here. Knowing what we know about it, that it can be more transmissible, landing more people in the hospital, it's something that can sound kind of scary. So what are the big takeaways for us with this news? What do we really need to know?
Well, Kate, as you said at the lead-in, and we've talked repetitively over the past year, there's no absolute endpoint to this. Things are going to keep going a little bit. So if you remember when what we were originally calling the UK variant, the B.1.1.7, which is now called Alpha, when that first showed up, we said, wow, this is 50% more transmissible than what we would consider to be the kind of baseline virus. Well, now we have this Delta variant, which is one of the variants of the predominant strain that's in India right now. And that one is, again, 50 or 60% more transmissible than the Alpha strain was. So there's real opportunity here for more infection to be had. Now, we are in fairly good shape here in Western New York, most of New York, most of the Northeast. We have fairly high immunization rates, but even if you have 60 or 70% immunization rates, that means you have 30 or 40% who are not immunized. And if you look in some other states, especially in the southern part of the country, they only have 30 or 35 or 40% of people immunized. So If this Delta variant becomes much more prominent in the United States, we're going to see more infections again. Now, will we see what we just had again, this past winter? I don't think so, and hopefully not. But I think there's opportunity for many places where their immunization rates are lower. In the southern part of the country, they're getting into their summer season now, so people are going to be heading indoors to the air conditioning. So you have a more transmissible variant, more people, and a stagnant airspace inside. And you see that, we could still wind up with a lot more infections, unfortunately. The good news about this variant is the immunity that is engendered by the vaccines, especially the mRNA vaccines, appears to work very well against it.
Yeah, and I want to ask you about the vaccination effort. New York State hit that 70% mark, and a lot of things are kind of fully back open now. That's adults with at least one dose. But the vaccine rates are slowing down. When you look at this as a chart, we were kind of going way up, and now we've flattened off or going down in terms of the rate of people. I wonder, going back to that long haul COVID story that we just mentioned, isn't that an incentive, or really explaining to people who maybe are younger, maybe are healthier, and maybe think, why should I bother getting the vaccine? Well, if you can have long-term health impacts from this disease, you want to avoid getting it.
Absolutely, Michael. The problem that we knew we were going to be up against, and actually when you look at the surveys, especially the Kaiser Family Foundation, vaccine hesitancy has gone down somewhat, but we're still down to that 30%. As you point out, we got about 70% in. What about that 30%? Now, there's a chunk of them who are never going to get vaccinated under any circumstance, but we know there's still a big group of them that if we can get through to them and get them immunized, it will be beneficial. And you're absolutely correct. We always look at things in terms of mortality rates because it's the ultimate, and it's also fairly easy to measure. But then you look at all of these other things. I still have friends and colleagues who had COVID a year ago and still don't taste or smell normally. So there are a lot of things that will happen. And again, this, the colloquial long COVID, the post-COVID conditions, some of these are very disabling for people. So I think this should be a good impetus to everyone, especially younger people. In some studies have been disproportionately represented in these post-COVID condition situations. So I think everyone should really look at this and say, now is the time. We know these vaccines are very effective and very safe. Now is the time to do it.
Always appreciate the perspective as we have every step of the way here. Dr. John Sellick is hospital epidemiologist for Kaleida Health. Dr. Sellick, thanks again for being here.
Great. Thanks. Great to be here.
And now a couple of stories from our Verified team. First, about a post that has been circulating online for a couple of weeks now, dealing with loosening COVID restrictions and Governor Cuomo.
Yeah, a viewer emailed us, and we'll show you what they said. Madeline Cuomo will wed Brian John O'Donohue on June 12th at the Cathedral of the Immaculate Conception in Albany, followed by a reception on the mansion grounds next to the church. Cuomo ended COVID restrictions right before daughter's wedding. Coincidence or planned?
There are also a ton of posts on social media like this one from today asking, did Cuomo open New York 3 days before his daughter's wedding? And we can verify, no, it is completely false. And we have found the source of this misinformation.
Yeah, we'll show it to you. This is a Buffalo News article that says Governor Cuomo's youngest daughter is getting married next month, and the wedding reception will be held at the Executive Mansion. It names Madeline Cuomo and Brian John O'Donohue, matching what that viewer emailed us. It says they'll wed June 12th at a church in Albany. Here's the problem. Take a close look at that date. This is from 1993. That is when Mario Cuomo was governor. It was Andrew's sister who got married.
The current governor does not have a daughter getting married this summer, so no, he did not loosen restrictions for that reason.
A lot of confusion on that one.
Yes.
Just people got that one way wrong.
Yeah.
All right, another story from our Verify team right now. Both incumbent Buffalo Mayor Byron Brown and his Democratic primary opponent, India Walton, will be on our air with these commercials this weekend leading up to Tuesday's election. A viewer sent us in this flyer from the Walton campaign asking us to verify the claims in it.
Here's one side of the flyer. It attacks Mayor Brown for taking money from real estate developers, corporations, and special interests, with pictures of Jeremy Jacobs, Carl Palladino, Steve Pigeon, and Louis Simonelli. We looked through public records on contributions. It is true that Mayor Brown has gotten campaign donations from these men, though none during this cycle. For instance, Palladino personally has only donated $100 to the mayor, and that was in 2013. An LLC from his company, Ellicott Development, also donated $2,000, but again, it wasn't during this election cycle.
Now, on the other side of the flyer, Walton says her campaign is 100% funded by everyday people and that she takes no corporate donations, no special interest money, and no contributions from real estate developers. Here's the problem, though. We can't actually verify that. If you look through Walton's donations, almost 30% of them are unitemized, adding up to more than $36,000. Now, that means we don't get the names or the addresses of the people who gave her the money. Walton's campaign points out you're allowed to do that as long as the donations are under $100. Her campaign manager said to us, quote, "The volume of small dollar donations we've received demonstrates the power of the movement we've built."
Now, a reminder, early voting continues through Sunday. The primary election is Tuesday.
Yeah, polls will be open on Tuesday from 6 in the morning until 9 at night.